We're going to start off by scanning my room. I have you guys on my tripod, so I'm going to scan you on my tripod. Ceiling, material, walls, floor. Okay. My name is Asia Green. I am a graduate student at the University of South Alabama. I am currently dual role FNP, AGA, CNP. I am currently enrolled in NU 518 Advanced Assessment. I will be performing a neuro assessment today. I have here Ms. Fortenberry. Ms. Fortenberry, can you give me verbal consent? Do you give me verbal consent to upload this video for grading purposes to my instructor?
I do.
Okay. So first, we're going to start off by checking the patient's mental status, looking at the patient appearance. Does the patient appear relaxed? Does the patient face appear relaxed? How's the patient posture? I'm going to look at the patient's clothing. Is the patient well-groomed? How's her hygiene? I do not have a foul odor. The patient clothes appears to be clean. Does the patient, is the patient addressed appropriate for age? Is the patient addressed appropriately for weather? She's 24 and it's 80 degrees here in Mississippi. So yes, the patient is addressed appropriately for age and weather. So next, I'm going to assess the patient's mood. In the last 2 weeks, have you felt little to no pleasure?
No.
In the last 2 weeks, have you felt down, hopeless, or depressed?
No.
All right, the patient's mood is appropriate. I'm going to assess the patient's judgment and perception. If you found a wallet down on the ground, what would you do?
Turn it in.
Okay, the patient judgment is intact. We're going to assess the patient's orientation. What is your name?
Kanisha.
What year is it?
2026.
Who's the president?
Trump.
And where are you currently?
Hattiesburg.
Okay. Patient is alert, awake, and oriented times 5. I'm going to assess the patient's immediate and recent and remote memory. First, I'm going to give the patient a phrase, and I'm going to come back to it later to see if she can recall it. The phrase is going to be, the car is red. Okay. Next, I'm going to assess the patient's abstract reasoning. So if I were to say to you, an apple a day keeps the doctor away, what would that mean to you?
Eat healthier so you don't have to go to the doctor.
Okay. If I were to give you calculations to test the patient's ability to calculate, what is 4 plus 3?
7.
What is 25 minus 5?
20.
And what is 25 times 4?
100.
All right, patient is able to calculate. Going back to the memory section, can you repeat to me the phrase?
The car is red.
Okay, patient's immediate memory is intact. If I were to ask you, what did you eat for breakfast today?
Pancakes and bacon.
And then what high school did you go to?
Wishbone.
Okay, patient's recent, remote, and immediate memory is intact. So next, what I'm going to do, I am going to move on to your cranial nerves here. So what I'm going to do, I am going to assess cranial nerve 1, which is olfactory. I am going to assess the patient's ability to smell and identify. So I'm going to ask the patient to occlude one side of your nose, and I want you to breathe in and out. Okay, checking for patency, do the second side. All right, nostrils are patent. I want you to occlude one side of your nose and identify the smell for me.
Peanut butter.
All right, correct. Occlude the opposite side and identify this smell for me.
Vanilla extract.
All right, cranial nerve 1, olfactory is intact. Next, I am going to move on to cranial nerve 2, which is the optic nerve. So what I'm going to do, I'm going to give the patient a card. We're going to be doing the Rosenbaum side. I'm going to give the patient a card holding it 14 inches away from her face. I'm going to ask the patient to read the lowest line she can read, covering one eye at a time and then both eyes. And we're going to test the patient's near vision. All right, cover one eye, read the lowest line you can read.
63925.
All right, that is 2050. Read cover your other eye.
63925.
Okay, that is 2050. Now with both eyes.
428365.
All right, that is 2040. So the patient's vision is 2040. The patient's near vision is 2040. If I wanted to assess the patient's visual acuity, I would stand 20 feet and have the patient read the lowest line she can read, covering one eye at a time and with both eyes. Let's say the patient was able to read 20/50. Let's say 20/50 was the patient's visual acuity. What that means, what the patient could read at 20 feet, the normal or average person with normal vision could read at 50 feet. So cranial nerve 2 olfactory is intact there. So next, what I'm going to do, cranial nerve 2 optic, is intact. So what I'm going to do next, I am going to assess cranial nerve 3, which is ocular motor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducent. So what I'm going to do, I am first going to look at the patient's eyes. I'm going to be assessing the patient's pupil size, if they're equal, if they're round, if they react to light, if they react to accommodation. And then I'm going to assess the patient's ocular motor, and see if the patient is able to follow with just her eyes these 6 cardinal directions. All right, so I want you to look straight ahead for me. Patient's pupils are brisk. They are about a 4 millimeter. All right, look straight ahead for me. I want you to focus on the pen light. All right, patient's able to perform. Next, I'm going to do with your eyes, only with your eyes, I want you to follow my finger. All right, I note no. All right, the patient does not have any type of nystagmus, any type of strabismus, or any type of deviation in her eyes. So optic nerve 3, 4, and 6 are intact. Next, we're going to do optic nerve 5, which is trigeminal. So I am going to be assessing the patient's temporal muscle, the masseter muscle as well. So what I'm going to do, I am going to ask the patient to clench her jaw, and I'm going to assess the 3 points on her face. So clench your jaw for me. Clench your jaw. Clench your jaw. Okay, now with the sharp and dull side, I'm going to ask the patient to close her eyes, and I'm going to do the same thing and see if the patient can identify sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
All right, cranial nerve 5 trigeminal is intact. Patient was able to identify those, and the patient did have good muscle there. So next, we are going to go to cranial nerve 7, which is the facial nerve. So I'm going to be looking for any type of abnormal movement and see if the patient's face is symmetry. So I'm going to ask the patient to puff out your cheeks, smile, raise your eyebrows, frown, clench your teeth. All right, cranial nerve 7, the facial is intact. Patient did not have any type of abnormal movement there. So next, we're going to do cranial nerve 8, which we will be cranial nerve 8, which is vestibular cochlear. We will be assessing the patient's gross hearing. So with the patient closing one ear, including one side of her ear, I'm going to stand 1 to 2 feet away from the patient, and I'm going to ask the patient to repeat back to me what I'm whispering to her. Any series of numbers or words.
2, 4, 6, 8. Who do you appreciate?
Okay. Same thing on this side.
The sky is blue, the grass is green.
Okay. Cranial nerve 8, vestibular cochlear is intact. The patient gross hearing is intact. So next, we're going to move on to cranial nerve 9, and we're going to move on to cranial nerve 9, which is glossopharyngeal, and cranial nerve 10, which is vagus. So what I'm going to do, I am going to test for phonation first. I'm going to have the patient say, "My name is," and I'm going to, when she say her name, I want to see if the patient has any type of hoarseness. So can you say?
My name is Kanisha.
Okay. Patient does not have any type of hoarseness going on. I am going to help the patient stick her tongue out while I shine my pen light in the back of her throat, assessing her uvula, her pharynx, and her soft palate, and we're going to see if it's midline, medial, and symmetry. So say "ah," tongue out, keep saying it. Okay, The patient's uvula remained midline. The patient's soft palate moved symmetrically, and the patient's posterior pharynx remained medial as well. So next, what I'm going to do, I'm going to assess the patient's gag reflex. Tongue out. Ooh. The patient's gag reflex is intact, and now I'm going to see if the patient is able to swallow. I'm just going to give her a sip of water. Okay. Cranial nerve 9 and 10, 9 glossopharyngeal and 10 vagus is intact. The patient was in fact able to swallow. All right, so then we're going to do cranial nerve 11, which is the spinal accessory. So we're going to be assessing the trapezius. So I'm going to ask the patient to shrug her shoulders against resistance. Okay. Then we're going to assess the sternocleidomastoid, or the STM. So I'm going to ask the patient against resistance to move her head. Okay. The patient was able to shrug against resistance, move her face against resistance. So cranial nerve 11, the spinal accessory, is intact. Lastly, we're going to do cranial nerve 12, which is hypoglossal. I am going to ask the patient to stick your tongue out, protrude your tongue out. We are looking for any type of deviation, making sure the tongue stays symmetrical side to side for me. Then we're going to test the patient's tongue strength. So I want you to put your tongue to your jaw, each side. All right, cranial nerve 12, hypoglossal. Hypoglossal is intact. So next, what we're going to do, we're going to assess the motor system. So I'm going to assess the patient's coordination. So what's next? First what I'm going to do, I'm going to have the patient rapidly alternate her hands, slapping her thighs. Okay. Then I'm going to have the patient do every finger to thumb rapidly. Okay. I'm going to have the patient do point-to-point system. So the patient is going to go from her nose to my index finger rapidly. Okay, I'm going to have the patient rub her heel to her opposite shin on both sides. All right, patient was able to perform these movements rhythmically with coordination, rapidly and smoothly. So next we're going to assess the patient's gait. All right, so I'm going to have the patient stand up. All right, and I want you to walk that way. We are looking for any type of balance issues, making sure the patient's posture stays upright. All right, we're going to assess the patient's tandem. So heel to toe, I want you to walk that way for me. Again, looking for any type of balance issues. Okay. All right, we are going to assess the patient's Rumbergs. We're going to do a Rumberg test. The patient's standing feet together, eyes closed for 15 to 30 seconds. We're going to see if the patient is able to stand straight up. We're going to stand close to her for safety reasons. We're going to see if the patient is able to stand up without any type of big swaying. Minimal swaying is okay. You can open your eyes. Minimal swaying is okay. But if the patient were to open her eyes to try to accommodate, the patient may have some type of ataxia issues there. So the patient had a negative test. She was able to perform that without swaying or anything like that. So next what I'm going to do, I'm going to have the patient sit. And we're going to assess the patient's sensory. Hands on your thighs for me. I'm going to assess for pain first. So we're going to have the patient identify between sharp and dull on upper and lower extremities. So tell me if this is sharp or dull.
Sharp. Dull. Dull. Sharp.
Okay. Tell me if this is sharp or dull.
Sharp. Sharp. Dull. Sharp.
All right. Patient's pain perception is there. Patient was able to identify between the two. Next, we're going to assess the patient's proprioception. So I'm going to have the patient close her hands with her pinkies out, eyes closed. And I want you to tell me in what direction I am moving your pinky.
Down. Up. Up. Down.
All right. Bilaterally, the patient was able to tell me which side, which way I was moving her pinkies. Next, we are bilaterally. Hold your hands out, both palms up. We are going to assess the patient's stereogenosis. We're going to see if the patient has identified an object I placed in her hand.
A pen. The pen light.
Okay. Patient was able to identify those things. Next, what I'm going to do, we're going to do graphesthesia. So what I'm going to do, I am going to write a number in each palm, and I want the patient to tell me what number I'm writing in her palm.
3.
Okay.
5.
All right, patient was able to do that as well. Next, what I'm going to do, we are going to assess the patient's reflexes. So the grading system that we use, for 0, it is absent. For 1, it is diminished. For 2, it is normal or brisk. 3 is brisker than normal, and 4 is very brisk with clonus. So with the patient elbow slightly flexed, palm towards pronated down, I am going to hold. We're going to do the bicep tending first. I'm going to hold the patient's bicep, and I'm going to strike with the pointed part of my reflex hammer, my thumb. All right, +2. Same thing on this side. +2 bilaterally for the bicep tending. So next, I am going to do the tricep tending. So with the patient's arm, hand pronated, the patient's palm facing towards her body, just above the elbow, I am going to strike again. All right, +2, just above the patient's elbow again. All right, +2 bilaterally for the tricep tending. Next, we're going to assess the patient's patella. So with my hand on the patient's knee, I'm going to go just below the patella. +2. +2. All right. So next, bilaterally +2. So next, what I'm going to do, I am going to assess the patient's Achilles. So the foot slightly dorsiflexed here. I'm going to strike the Achilles. +2. Slightly dorsiflexed. +2. All right, next, I am going to assess the patient's ankle clonus. So what I am assessing for is any type of continuous clonus movement. With the foot slightly dorsiflexed, I am going to dorsiflex and plantar flex the patient's foot. If it continues with her leg resting in my hand, if it continues to go rhythmically, the patient could have some type of spinal issue. The patient could be under the influence of some type of drugs or alcohol, or the patient could be post-ictal from a seizure. So next, what I'm going to do, I am going to slightly, with the patient's foot slightly dorsiflex, I am going to assess the patient's plantar flexion. We are looking for a positive or negative Babinski sign. With the end of my reflex hammer, I am running the bottom of the reflex hammer immediately towards the ball of the patient's foot. What I am looking for, if it is a positive Babinski sign, the patient's toes will fan out. If it is a negative Babinski sign, the patient's toes will curl up. The patient's Achilles was bilateral, well, +2 bilaterally as well. And the patient had a negative clonus, ankle clonus, and a negative Babinski sign. So I'm going to scan my room one more time. Thank you.